This is part 2. We are going to go over Jasmine Sherman's policies. We're going to continue with Conventional Rights of Children policy. In recent years, we have observed an increase in more communicative and supportive parenting techniques that allow children to better process their needs and emotions. The phenomenon that is The phenomenon that is gentle parenting is becoming a more widespread practice as newer generations dissect the advantages of having more thoughtful and capable individuals. Gentle parenting is a parenting approach that encourages a partnership between you and your child to make choices based on an internal willingness instead of external pressures. Sourced from Guidepost Montessori. The parenting style removes corporal punishment for emotional support and accountability. Though traditionally, as a society, we have justified the use of actions like caning and spanking as discipline for children, the facts suggest that this doesn't lead to the more capable adult, corporal punishment. Since the premise surrounding the having of children is for the future of our nation, doing everything in our power to ensure the progress and maintenance of this country is paramount. This would mean that for the past few centuries, we have been inhibiting our overall growth and development as a society due to not applying humanity in our parenting and education. Considering children, the future humans meant to foster our ever-developing society, we would like to extend them the kindness of learning in a healthy manner in the home and in school. The conventional rights of the child is that they are learning human beings and deserve to be treated with respect. COVID-19 policy. Introduction. In response to the ongoing COVID-19 pandemic and in conjunction with our existing COVID-19 policy, we propose a comprehensive approach that includes a 6-week transitional lockdown starting on the 92nd day of Jasmine Sherman's presidency. This integrated policy combines measures such as mandatory masking, mandatory vaccinations, exemptions for religious and health reasons, housing initiatives for the houseless population, and transitioning individuals impacted by the carceral system to secure housing. During the lockdown, citizens will receive support through social programs, including food, supplies, and bill payments, facilitated by a delivery system akin to Instacart and aided by the National Guard. Comprehensive COVID-19 measures. Mandatory masking. Requirement: all individuals in public spaces, indoor or outdoor, are required to wear masks that cover their nose and mouth at all times, except when eating, drinking, or in a private residence. Enforcement: non-compliance may result in fines or penalties, with a focus on education and community support for those who have difficulty obtaining masks or understanding the importance of masking. Mandatory vaccinations. Vaccination requirement. All eligible individuals must receive a COVID-19 vaccination. Exemptions. Religious exemption. Citizens may request a religious exemption from vaccination, provided they submit a sincere written statement of religious objection. Medical exemption. Medical professionals are not eligible for exemptions, but individuals with certified health conditions preventing vaccination may be exempt. Enforcement. Regular vaccination checks and educational campaigns will be conducted to encourage compliance. Transitional lockdown and supportive measures. Transitional lockdown. Purpose. The transitional lockdown aims to address homelessness and provide housing for those impacted by the carceral system while mitigating the spread of COVID-19. Housing initiatives. Comprehensive efforts will be made to identify and provide stable housing for the houseless population. Carceral system transition. Individuals currently impacted by the carceral system will be transitioned to secure housing options with support programs. Temporary suspension of work. During the 6-week lockdown, citizens will not be required to work. Economic support will be provided to ensure financial stability. Social program deliveries. Instacart-like delivery service. A dedicated program similar to Instacart will be established to deliver essential goods, including food, supplies, and medications, directly to citizens' homes. National Guard assistance. The National Guard will play a key role in facilitating these deliveries, ensuring the efficient and timely distribution of essential items to all citizens. Financial support. Bills and utilities. The government will cover essential bills and utilities such as rent, electricity, water, and internet for the duration of the lockdown. Food security. Citizens will receive financial support to ensure access to nutritious food throughout the lockdown. Oversight and evaluation. 1. Transparency and accountability. A dedicated oversight committee will ensure that resources are allocated appropriately and that the citizens' needs are met. 2. Regular assessments. The policy's effectiveness will be assessed regularly, and adjustments will be made as needed to address any emerging issues. This comprehensive policy integrates COVID-19 containment measures with housing initiatives and support during the transitional lockdown. It aims to address public health concerns while ensuring the well-being and security of all citizens. Continuous evaluation and adaptation will be key to its success, which is why we present this policy in this format, which can be adjusted as new strains and information come out. Death penalty policy. Asterisk. Jasmine wishes to inform the readers that this post is being preserved to uphold transparency. While the death penalty contradicts the Green Party's platform, it would be disingenuous to ignore the evolution of Jasmine's stance on this matter. Their transition from previous support to a different standpoint is noteworthy, highlighting that a candidate's position is not solely driven by personal preferences, but also reflects the desires of their constituents. Purpose: institute a federal standard for capital punishment. Scope: encourage states to be more efficient with resources surrounding the enforcement of capital punishment. Our policy: capital punishment is to be reserved for those convicted of mass killing and serial killer events only. Due process is to take no more than 1 calendar year. There should be 2 options available for the execution: morphine overdose or firing squad. All other capital punishment cases will remain as they are or will be subject to incorporation into the Unicorn Party's restorative justice treatment program. Definitions: mass killing event: a multiple homicide incident in which 4 or more victims are murdered by any means, within one event, and in 1 or more locations in close proximity. Serial killing: the unlawful killing of 2 or more victims by the same offenders in separate events. For this policy, the death penalty policy, I'm curious about how the people who are currently in power will be dealt with, because what has been going on in Gaza, what has been going on in Congo, what has been going on in Sudan has been genocide, has been mass killings, and it has been approved and even encouraged by the US government. So I'm curious how this would be handled in this case. Disability policy. It's a long one, so I gotta take a sip. Disability policy. This policy is a series of additions and revisions to the Americans with Disabilities Act, the Medical Standards of Care, and the Uniform Federal Accessibility Standards. The goal of this policy is to ensure that all Americans with disabilities are guaranteed the same rights, care, dignity, and quality of life that non-disabled Americans are. Public and private access. Under this policy, all buildings, both public and residential, will be held to stricter standards regarding accessibility and accommodations for disabled individuals. All buildings that aren't true historical buildings will be held to the most recent publication of the ADA standards, and these standards will be revised and added to better represent how accessibility needs have changed since the 2010 revision of the ADA. Public transportation, outdoor spaces, and sidewalks will also be held to higher standards under the new revisions of the ADA, and all of these standards will be more consistently enforced by the Department of Justice and by the Department of Transportation. Now I'm curious that it says all buildings that aren't true historical buildings, because why wouldn't a true historical building also be adapted for people who are disabled? Why wouldn't that be as well? Just something that I wanted to know. Changes to the ADA regarding buildings. 35.151 is the law under the ADA that specifies which buildings must meet accessibility standards and which are exempt. Under the 2010 publication, any building built before the revisions took effect in 2012 only has to comply with the 1992 publication of the ADA. So, under the 2010 publication, any building built before the revisions took effect in 2012 only has to comply with the 1992 publication of the ADA, without the exception that allows places to not provide elevators. Buildings built before the 1992 ADA standards of accessible design and building must only comply with the UFAS. Religious buildings, religious-owned organizations, and private clubs are exempt from meeting the ADA standards, but may be subject to local accessibility standards. 35.15a is going to be revised so that all buildings that must meet ADA standards are required to meet the most recent version of those standards. This is also going to remove the regulations about taking cost into consideration when thinking about renovations or making a building accessible. There will be no more disproportionate cost that prevents buildings from completely meeting the ADA standards. Some of the standards that have changed between the 1992 version and the 2010 version are regulations on ramps, door widths, accessible signs, accessible bathrooms, and more. These include dimensions as well as safety measures. Excuse me. These include dimensions as well as safety features. Another exemption that will be removed is the religious exemption that states that religious institutions or organizations are not required to follow the ADA standards of accessible design. This exemption is a violation of the First Amendment because it impedes on disabled people's rights and ability to practice religion. Amen. Public transportation access. All public transportation must meet ADA standards. This includes but is not limited to buses, trains, planes, and private transportation companies that serve the public, such as Uber and Lyft. Disabled people must be able to safely and easily navigate the route to the entrance of the public transportation, and they must be able to safely and easily ride on the public transportation. Many of these laws are already included in the ADA, but are not enforced or are selectively enforced. Under this policy, these standards will be strictly enforced, universally across the country. Buses. Bus stops should be both wheelchair accessible and have signs written in large, contrasting fonts with braille and spoken options. Yeah. There should be an auditory alert that the bus has arrived at the bus stop for blind and visually impaired individuals. Yes. Buses should all have a wheelchair lift on the back or side of the bus, as well as the wheelchair straps that come out of the floor to hold a wheelchair in place so that the disabled person doesn't slide around in the moving vehicle. There should be at least 2 spots for wheelchairs and more when possible. There should also be accessible seating on the bus with plenty of space for mobility aids or service dogs. Trains and subways. Trains and subways need to have a lot of the same accessibility features as buses and bus stops. They need to be completely wheelchair and mobility aid accessible, including but not limited to wheelchair straps in the floor, a ramp or elevator down to the station, handrails on any stairs, and ramps that fold out to cover the gap between the platform and the train so that wheelchair users don't get their wheels stuck in this gap. so that blind and visually impaired people don't fall into this gap, and so that other mobility aid users don't trip or fall into the gap. Yum. Lifts, Ubers, taxis. Lifts, Ubers, taxis, and any other transportation like this falls under ADA protections because it's a public business. This means that they must have an accessible option and accessible vehicles for disabled people that need it. While this is something that these services sometimes offer, it is not offered widespread in the same way that these services are, and many disabled people in many places are not able to use these services because they don't offer an accessible option in their area. This policy will require all of these services to have an accessible option in every single location that they are offered, or to provide an equal alternative to disabled individuals. Some examples of accessibility that are necessary for these rideshare apps are vehicles with a wheelchair lift, vehicles with a wheelchair ramp, and drivers that can and are willing to assist disabled people. Planes and air travel. There are already a lot of regulations in place, to make sure that airlines are accessible to the public, but a lot of these fall short. Some of these issues include security, boarding the plane, taking care of mobility aids, and lack of access during the flight. If a disabled person has any kind of medical equipment, there are far more rigorous checks going through security than people that don't have any kind of medical equipment. And sometimes airlines even try to require people to remove things that are attached to their bodies or can't be removed for any reason, like hearing aids, insulin pumps, prosthetic limbs. Security also sometimes makes people use the wrong mobility equipment to go through security so that they can inspect their mobility equipment, which can leave a lot of people in pain. I'm going to just repeat that last sentence so it sticks. Security also sometimes makes people use the wrong mobility equipment to go through security so that they can inspect their mobility equipment, which can leave people in a lot of pain. Some examples of this are as follows. Makes people transfer to a hospital wheelchair from their custom one. Making people on crutches. Makes some people use mobility aids that don't help. Ambulatory wheelchair users being made to walk with a cane just because they aren't paralyzed. And airlines break wheelchairs and lose mobility aids. Depending on the specific airline, up to 7% of wheelchairs, which is a very high number, are broken or lost during the flight. This leaves disabled people without the ability to have their independence or live. Most wheelchairs are custom made to a person's exact measurements, needs, and body. So the temporary wheelchairs that airlines send out to replace ones that are broken or lost are not adequate and can cause severe issues for the disabled person using them. A wheelchair that isn't properly fitted can cause sores, bruising, and repeated stress injuries. Airlines have virtually no training in how to properly load and unload wheelchairs, and this results in many being broken, but especially electric wheelchairs, because they weigh more and are more delicate than most manual ones. Additionally, they don't understand that some aids cannot be exposed to radiation. Some aids are physically attached to the body and not removable. Disabled people get left on locked planes because the staff forgets to help them exit the plane. Going through security can be a struggle, as some medical equipment cannot be exposed to the X-ray machines. Additionally, there are other reasons a disabled person may not be able to go through these, such as pacemakers and some hearing aids. Disabled people often need assistance getting on and off airplanes because the aisles on the plane aren't big enough for most traditional wheelchairs, and there isn't enough storage in the cabin for wheelchairs during the flight. Usually, airlines have their own aisle chairs that they use to help transport disabled people onto planes. But there have been several times now that airline staff have forgotten that there were disabled people who needed to be let off the plane after the rest of the passengers, and lock them in the dark plane alone. Airlines need to have more training and protocol in place to prevent these kinds of things from happening ever again, such as a final check on planes to make sure that there are no passengers left on board or other regulations. Disabled people in wheelchairs don't have access to those wheelchairs on the flight. They aren't given any choices about whether or not they can go to the bathroom during a flight, regardless of how long the flight is, and regardless of the fact that many disabled people have bladder or bowel issues. And here are just some other inconveniences at best and infringement upon disabled people's basic rights, really, if we're going to really be literal in what these really are. These are just a simple list that they prepared. Denying service dogs based on breed or size, not giving seats with enough space for service dogs, making mobility aids go in some kind of storage like canes, crutches, walkers that could fit in the seat with the disabled person, lack of access for blind individuals, incredibly hard to navigate airports without adequate signs, and incredibly hard to get a guide to walk you to your destination through the airport, loss of medical supplies, trouble bringing medications and medical supplies through security, and lack of accommodations for food, drinks, and medications on board the flight. Okay. Next up is doctor intersectionality training. Doctors are in charge of treating any health conditions that someone may have and making sure that people can live the best quality of life possible. But many doctors aren't trained in intersectionality or how to treat patients of different minorities. Caregivers and aides. Caregivers have a variety of jobs to help disabled people in their everyday lives. There are different kinds of care that a person might need, and there are many different reasons that a disabled person might need a caregiver. Caregivers, as a whole right now, are underpaid and overworked, and I can say that this is true, being that I have been a caregiver in the past for accumulatively more than 2 years. Under this policy, caregivers, including familial caregivers, will be compensated for all of their labor, and the disabled person will be provided with respite caregivers to take over while their normal caregivers take time off, have vacations, and take sick days. It is our belief that all people should be fairly compensated for all of their labor, as well as having access to paid sick leave, vacation time, and time off if they want it. Any amount of hours that a person needs from a caregiver will be covered. Just lost my place, excuse me. Any amounts of hours that a person needs from a caregiver will be covered, including people who need 24/7 assistance. In the case of familial or friends being caregivers for their loved ones, they will also receive a free training course on the basics of caregiving if they want it, so that they aren't trying to navigate medical tasks without any knowledge or training. In addition to traditional caregivers, there are other things that disabled people need assistance with that aren't typically covered. Some of these include yard work, house cleaning, childcare, such as times when there is a flare-up, hospitalizations, or otherwise worse symptoms that are usually well managed. Assistance shopping, assistance filling out forms, and people who manage finances. Any type of assistance that a disabled person needs will be covered under this policy, as well as any kind of assistance tool, such as grabbers, button hooks, non-spill silverware or glasses, bidets, and anything else that would improve disabled people's independence and quality of life that they may not have access to otherwise. CNAs, or certified nursing assistants, can provide many of the care tasks that a disabled person needs, but not all of them. The job of CNAs is to provide basic nursing care to people. This includes things like helping someone get into wheelchairs, hygiene, eating and drinking, changing bandages, providing medications, and port access. CNAs also do some other tasks, but the main job is to assist with hygiene and basic medical tasks that someone needs. Legal guardians and people under guardianship. This policy is going to increase the protections of disabled people under guardianship in order to guarantee them their rights to independence and to protect them from abuse by their guardians. Every person under guardianship will have someone who frequently checks in to ensure that the disabled person is making progress towards independence or at least learning valuable skills. Guardianship will be reevaluated on a yearly basis to ensure that the person under guardianship still has a need for it. These reevaluations include proving to a court, again, that the person under guardianship still has a need for it and showing any evidence of how they have or haven't progressed since the last decision. Along with frequent checks to ensure that the disabled person needs to remain under guardianship, there will be different types and levels of guardianship for disabled people on a case-to-case basis. Disabled people need access to both medical patient advocates and non-medical case management. Service animals. Under the current ADA standards, the only animals that can be legal service animals and have public access are dogs, excuse me again, and in very rare cases, miniature horses. There are many animals, though, that can be both trained to the public access standards and fill a certain need or task that disabled people need that other animals can't. An example of this is rats. Rats are very intelligent and far easier to train than dogs, and some people have started training them to be able to smell to detect blood sugar changes the same way that diabetic service dogs are able to. Rats, in addition to being easier to train, are also easier to care for and smaller, so they're easier to have discreetly in public, or easier to keep close to your breath or chest if that's where they need to be able to perform their tasks. The laws about service animals with public access haven't ever been changed or updated, and this policy will update these laws to include select different species of animals that can fill certain needs or be more accessible to disabled people that aren't currently guaranteed legal public access. In addition to changing the types of animals that can legally be service animals, under this policy, service dog training programs will have far stricter regulations on what they can require of disabled individuals to keep their service dogs, a federal uniform standard of training, and all service dogs and equipment for them will be provided free of charge to the disabled person. Currently, there are no federal regulations on training programs for service dogs, and many of these programs have their own highly specific regulations on the handlers that get dogs through them. Some of these regulations include not changing the dog's diet, the dog not gaining or losing weight over a certain amount, not using company-provided vests, collars, or leashes, not changing the dog's name, not training new tasks or retiring old tasks for the dog. These companies are allowed to repossess or take back custody of dogs if the handlers don't follow whatever rules that they've set, which is taking medical equipment away from disabled people. Under this policy, there will be federal regulations on what these companies can require from handlers, and they will no longer be allowed to take dogs back for any reason other than neglect or abuse. Access and ease to reporting discrimination. Everyone should have access to and know their rights, as well as the ability to report when those rights have been violated or when they've been discriminated against. Part of this policy is to ensure that disabled people are readily able to report violations of the ADA that they encounter in public and any discrimination or harassment that they may face by public employees, businesses, doctors, or from their employers or co-workers. Mental health. Inpatient mental health facilities are currently lacking in regulations and screening of doctors. The way that they are currently run is often more traumatic than helpful for people that get admitted there, and they're more about controlling and punishing patients for struggling than they are about recovery. This policy seeks to have far stricter regulations on both the doctors working at these facilities and the types of treatment and punishments that these facilities are allowed to implement in their practices. Under this policy, all forms of drugging from these doctors will be banned. This is usually called sedation and is done in the form of an injection of high doses of benzodiazepines, or antipsychotics against people's will. These are done to control patients and make them less combative when they're doing things or displaying symptoms of their mental illness that the staff doesn't want to deal with. Dosing patients with medications against their will or knowledge is already forbidden under several laws about patient care, and this should be enforced for patients struggling with mental illness as well. Forced restraints are another abusive practice in the mental health field that are going to be banned under this policy whenever possible. Most patients who are 5150 sanctioned are put into handcuffs for transport, and sometimes these handcuffs are locked so tight that they cause physical injuries on top of being traumatic. People are also tied to beds and locked in rooms for having difficult symptoms of their mental illnesses, which they're actively seeking treatment for. Any restraint on any patient under this policy is only allowed if the patient is posing an active threat to other people, or if they're actively trying to hurt themselves, even in care, and all other options have been exhausted, like trying to talk to them, comfort them, and offering them sedatives or anti-anxiety medications. It must be used as a last resort only, and any restraint and every restraint must meet certain standards. Isolation is another tactic that these facilities use to punish people who are in an incredibly vulnerable state. Children are among the most vulnerable people, and their rights need to be strictly protected, including from parents and caregivers, and heavily regulated. Children need to have the same privacy rights that adults have, especially in the mental health field. Under this policy, therapists and psychiatrists only have the right to tell the parents if the child is actively hurting themselves, plans to hurt themselves, or is actively hurting others or plans to hurt others. They will only be able to report things that are already covered under mandated reporting laws. Mandated reporting laws will also be updated so that any parental abuse will be reported to professionals that are not in the family. Decriminalization of drug use and possession policy. More than 1.5 million drug arrests are made every year in the U.S., the overwhelming majority for possession only. Decriminalization is the process through which the legislature removes criminal sanctions against an act, omission, article, or behavior which is considered a crime. Decriminalization means it would remain illegal, but the legal system would not prosecute a person for the act. The Sherman administration is going to decriminalize all drugs, which will eliminate federal and state criminal penalties and collateral sanctions for drug use and possession. The war on drugs is a global campaign led by the United States federal government of drug prohibition, military aid, and military intervention, with the aim of reducing the illegal drug trade in the United States. To put it simply, it is a war on people. It is a way to oppress people and keep the prisons full of free labor. Full for free labor, yeah. There are many benefits to decriminalizing drug use and possession, mainly a start to ending the war on drugs. We will no longer be relying on the criminal justice system to police people who use drugs. We are ending the stigmatization and meeting people where they are at. Decriminalization policies will be accompanied by an expansion of harm reduction and treatment programs, including medication assisted treatment, or MAT. Harm reduction is a combination of practical strategies aimed at reducing negative impacts related to drug use. Harm reduction is also a movement for social justice based on the basic rights of people who use drugs. Programs will be created to facilitate this in all communities. By doing so, we are able to change our focus to treatment and harm reduction services that provide significant benefits for public safety and health, including reduction in arrests prior to police abolition, reduction in the number of people incarcerated prior to closing prisons, increase of people entering drug treatment programs, reduction of criminal justice costs. The funds will be allocated to social programs. Decriminalization of drugs does not increase drug use rates. Countries that have adopted less stringent policies or decriminalization of drug use and possession have not experienced any noteworthy increase in drug use, harm, or crime in comparison. A World Health Organization study showed the U.S. had the highest lifetime drug use rates by a wide margin, even with our current anti-drug policies. This study supports that decriminalization has little or no effect on rates of use. Safer Drug Consumption Services, SCS, will be added to every zip code. An SCS is a designated site where people who use drugs can use pre-obtained substances under the safety and support of trained personnel. Over the last 30 years, these sites have been created in over 100 sites in over 60 cities in 11 countries around the world. SCSs can save millions of dollars per year and do not increase drug use, crime, or presence of drugs into communities. There will be standards of care and aesthetics in the facilities, including but not limited to all personnel will receive training and be held to guidelines of treatment of All personnel will receive training and will be held to guidelines of treatments of clients. All personnel will be required to attend therapy weekly. I love that one. The spaces will be welcoming and have a comfortable aesthetic while maintaining a sterile environment. These facilities will feel like a space to be safe and not like a doctor's office. A survey will be provided to all clients after each session/use of the facility. And there are some photos here of current SCSs as well that you can find. Syringe Services Programs, or SSPs, also known as Syringe Exchange Programs, or SEPs, will be available in the SCS. These programs will be created in each zip code and will provide access to sterile supplies and facilitate safe disposal of used supplies. Providing people access to SCSs and SSPs or SEPs will include the following benefits, services, and programs: education about overdose prevention and safer injection practices, overdose prevention, distribution of naloxone, and education for overdose reversal, reduction of injection-related infections, abscess, and provide wound care, safe disposal of syringes and reduction of injections that occur in public, referral to substance use treatment programs, mental health, social services, and other medical services, screening for viral hepatitis and HIV, care and treatment, vaccinations including hepatitis A and hepatitis B, sexually transmitted infection screening, reduction in the transmission of HIV and Hep C. Please refer to Universal Healthcare Policy as these services will be 100% covered. Czechia, the Netherlands, Portugal, and Switzerland are a few countries that have decriminalized drug use/possession for personal use and invested in programs of harm reduction. As a result, the use of injection drugs is low in these countries. Amazing. FAQs. Do SSPs cause more needles to be found in public places? No. Studies show that SSPs provide protection to the public and first responders by implementing safe needle disposal. This causes a reduction in the presence of syringes found in the community. Do SSPs lead to more crime and or drug use? No. SSPs do not cause or increase illegal drug use, nor do they cause an increase in crime. Are SSPs cost effective? Yes. SSPs reduce healthcare costs as they are helpful in preventing the spread of HIV, viral hepatitis, and other infections, including endocarditis. This is a life-threatening heart valve infection which can be common for people who use drugs intravenously. The estimated lifetime cost of treating one person living with HIV is more than $450,000, and hospitalizations of substance use-related infections in the U.S. cost over $700 million each year. SSPs reduce these costs and help people get connected to treatment to stop using drugs, if that is what they want. Do SSPs reduce drug use and drug overdoses? SSPs help people overcome substance use disorders when that is the desired goal. People are more likely to enter treatment for substance use and reduce or stop when they have access to SSPs. A study shows people who had access to an SSP were 5 times as likely to enter treatment as those who didn't use the programs. People who have regular access are also nearly 3 times as likely to report a reduction. People who have regular access are also nearly 3 times as likely to report a reduction in use or stopping injecting drugs as those who have never used an SSP. These programs assist in reducing deaths by overdose by training people who use drugs how to prevent, rapidly recognize, and reverse opioid overdoses. People will be provided overdose rescue kits and education on how to identify an overdose. This includes giving rescue breaths and administering naloxone, which is a medication used to reverse overdose. According to the United Nations, Portugal's policy has reportedly not led to an increase in drug tourism. It also appears that a number of drug-related problems have decreased. Independent research concludes that there is ample evidence of a successful reform. Amazing. And our last policy for tonight is the Decriminalize sex work policy. Sex work is the consensual exchange of sex between adults for a fee. Criminalizing adult, voluntary, and consensual sex, which includes the commercial exchange of sexual services, is not compatible with the human right to personal autonomy and privacy. The government should not be telling consenting adults who they can have sexual relations with and the terms associated. Sex work is work. Criminalization of sex work exposes sex workers to abuse and exploitation by law enforcement officials such as police officers. Human Rights Watch documented that police officers harass sex workers, extort bribes, physically and verbally abuse sex workers, and have even forced or coerced sex from them in criminalized environments. The Sherman administration will decriminalize sex work federally. This will destigmatize this work and remove criminal charges. It will also maximize sex workers' legal protection and their ability to exercise other key rights. These rights include justice and health care. Legal recognition of sex workers and their occupation maximizes their safety, dignity, and equality. Decriminalizing this work reduces risk for the people engaged in sex work. Studies confirmed the adult and pornographic websites industry is worth $1.1 billion in 2022. Sex work in the United States is estimated to generate $14 billion per year. Lyon County in Nevada receives approximately $400,000 to $500,000 per year from these taxes. By legitimizing this work, this money will be added to the economy and prevent people from falling through the cracks. Human trafficking and sexual exploitation of children are separate issues. They are both serious human rights abuses and crimes. Any allegation of either of these should always be investigated and prosecuted. Laws that clearly distinguish between sex work and crimes such as human trafficking and sexual exploitation of children help protect both the sex workers and the crime victims. All right, everybody, that's all we're going to be doing for tonight. I hope that these policies give you something to think about, and I hope that you communicate and start focusing on the solutions. Start focusing on how to build a better world. Have a good night.